Today I want to talk about occupational safety and health, the use and standard of exposure of chemical hazardous to health, which is Regulation 2000. This regulation is under Occupational Safety and Health Act 1994. This is the chemicals and management cycle from cradle to grave. There are three ways for chemical management. The first one is the import chemical would then go to storage and then export, or the imports chemical will then go to storage and transported and distribution and for usage. After use, it can be either disposed or recycled. If the chemical is recycled, it will then go to production and then begin the cycle again at the storage. This is the current legislation enforced by DOSH. There are three laws currently enforced by the DOSH. First is Factories and Machinery Act 1967, and there are 40 regulations. The second is Petroleum, which is Safety Measurement Act 1984. And lastly, Occupational Safety and Health 1994, and there are 7 regulations. There are 10 chemicals that is prohibited under the OSH Order 1999. First one is 4-aminodiphenyl. Second, benzidine. Third, 2-naphthylamine. Then fourth, 4-nitrodiphenyl and their salt and any substance containing them exceeding 0.1%. Fifth, benzene. Sixth, carbon disulfide. Seventh, carbon tetrachloride. Eighth, N-hexane. Ninth, white phosphorus. 10th, crocidolite. These chemicals were prohibited because it is hazardous and can affect the health and is proven to be carcinogen. What is OSH Regulation 2000? It is the use and standard of exposure of chemicals hazardous to health. It is made under the section of 66 of OSHA 1994, and it is to protect the safety and health of employee and other person from being affected by the chemical hazardous to health used at the workplace. And it is gazetted on 4th April 2000 and come to enforce on 4th April 2001. The rationale of using use regulation is to provide legal framework for the employer to control use of chemical hazardous to health. Second, it is to set the workplace exposure standard in order to protect the health of the employees and others at the place of work. And lastly, it is to promote excellence in management chemicals hazardous to health. Use regulation must be applied in all places of work within the purview of the Occupational Safety and Health Act 1994, where chemicals hazardous to health are used, as it was gazetted on 4th April 2000. What is chemical that is hazardous toward health? First, it is chemical with permissible exposure limit listed in the Schedule 1, and there is 600 chemicals. And second is the CPL regulation, which is very toxic, corrosive, harmful, irritant, including carcinogen, teratogens, and mutagens. The third one is the scheduled waste under Scheduled Waste Regulation 1989. And the lastly is the pesticide under Pesticide Act 1974. There are some chemicals exclusion from the compliance of USEC regulation, where the certain place of work are excluded if the chemical substance used are: first, radioactive material; second, foodstuff; third, pharmaceutical products; and lastly, hazardous to health, solely by virtue of their explosive or flammable properties, or solely because they are at high or low temperature or a high pressure. Salient provision of USAID: the identification of chemicals hazardous to health, permission exposure limits, assessment of risk to health, action to control exposure, labeling and relabeling, information and instruction training. The permissible exposure of chemical according to ceiling limit. Exposure to chemical hazardous to health listed in Schedule 1 must not exceed at any time, and according to Regulation 7, 8-hour time weighted average airborne concentration in Schedule 1. And for the maximum exposure limit, which is 15 times time weighted average, which is 3 times 8-hour time weight average. The assessment of USAID regulation shall be reviewed if there is significant change in the work and it is more than 5 years. The assessment must be directed by the DG DOSH. The assessment must contain potential risk, method and procedure, nature of hazard, degree of exposure, health risk, training and retraining, health surveillance, monitoring program, accidental exposure, control procedure, exposure control procedure. And the assessment must be carried out by an assessor registered with DOSH. The assessor must furnish the employer the report of assessment within 1 month of completion of assessment. If the result of assessment indicate likely cause immediate danger, assessor must inform employer immediately. There are 10 steps in chemical health risk assessment. First one is to gather information, and second, divide into work unit, and third is to determine the degree of hazard of chemical hazard towards health in each work unit, and fourth, evaluate the exposure from all possible routes of exposure, either inhalation, dermal, or ingestion. The fifth step is to determine the level of risk, and then assess adequacy of existing control measures. And 7 is to conduct the assessment, and then identify action is taken. The 9th step is recommendation and assign action priority, and the last step is to prepare, present, and submit the report. There are 3 categories of control methods. First is source, second, path, third, receiver. The source is elimination, isolation, total enclosure, modification, and substitution. For path, it is the engineering control. And lastly, the receiver is the safety operating procedure and the PPE. This is the hierarchy of control methods, from the most useful to the least useful. The most useful methods of control is elimination, which protect the environment and the surrounding, followed by substitution, total enclosure, isolation, modification, engineering control, SOP, and the most least useful is PPE, which protect the person. Salient provision of USAID: monitoring of the exposure workplace, health surveillance, medical removal protection, warning sign, and record keeping. As per mentioned by the assessment of risk to health, if a workers exposedly or likely to expose to CHH listed in Schedule 2, monitoring interval shall be repeated in not more than 6 months. For medical removal protection, when exposed to chemical hazard, it will increase the risk of material impairment towards health. It must be removed until the employee is no longer has detected medical condition. And for pregnant or breastfeeding employee, it must be removed until the employee is not pregnant or breastfeeding anymore. Safety works when people work together. Thank you for watching. Hope you have learned something new from this video.